Any other remark, Jean-Michel? Severino.
Merci, Jérôme. My name is Jean-Michel Severino. I formerly worked in the development policy and as a professional in this sector and having especially, among others, run relatively large health programs, I've been growingly frustrated by the way world governance related to health has evolved. And I would be very interested in your reactions, especially from the business on this. Trying not to be too long, what we have seen over the past decades is a kind of fragmentation of the global governance around health, with a growing number of stakeholders, private, public, definitely the governments losing the leadership in this structural policy, with, as a consequence, growing management costs applied to this policy, lack of vision for several reasons, part of them being that some of the key stakeholders in the health system, as Jean-Pierre was mentioning, such people, in the stakeholders in the area of health and nutrition are out of the policy, basically, even though they are very large contributors to the outcomes, as was outlined. Second, because large sectoral policy or thematic policies around special diseases have emerged, with sometimes a weak relationship with domestic policies in countries and leading to very strong biases and local inefficiencies. And it has been very difficult, it has been more and more difficult to see how one could get back, if ever there has been some consistency in the past, but how one could get to, maybe you should say that, to more coherence, structured vision, and shared goals, not about what the ultimate goal, which is reducing mortality and morbidity, but what specific diseases, what specific areas, what specific structural policies, what type of combination of quality and quantity, because it's very unclear now whether we are looking for reducing costs, increasing access, or curing specific diseases that are highlighted by public opinions emotionally as the core goals of the policy. So all this has become more and more fuzzled. And I wanted to ask you guys on the panel how you see that, how comfortable or uncomfortable you are yourself as business players, especially in this context. And as a consequence, what is the type of consequence that you take out of this landscape, if you agree on it, of course, but you may not share this view, of course. And how you, especially in this context, manage your relationship with this global governance yourselves, how you fit into it, what is the type of construction you would like to see. I mean, if only in order to defend your own interests. I mean, you have legitimate interests as a business that may be different from other stakeholders. That's how life is structured. So what would you see as the best and structured mechanisms that would allow a sound debate, which ultimately you would be comfortable with, for instance?
For you? Yes, definitely. So, well, I think that if I try to give some comments on what was said, I would personally agree on the fact, on your point you made, which is key, that we should differentiate the medical industry and the health as such. It's obvious that when you look at the basic of demography and what you mentioned about life expectancy, there is clearly basic elements which are not directly linked or indirectly linked to quite a large part of the activity of the Medicare or the healthcare industry. So in that respect, I think that this is a fairly good point. I think second, what we must recognize that at least we as healthcare industrials, yes, we are one player in this industry, but we are only one player at the end of the day. The way the healthcare systems are organized, and you give advice to governments on how to organize that, is as important as what we can bring. I think what we can bring is two things. Is as we like to say, is a productivity and availability of drugs when it comes to the pharma industry, and B, innovation. And I mentioned the fact that I joined this industry rather recently, and it's far from being obvious that before I joined that the best existing mechanism to develop innovation and to create innovation into a new treatment is coming from a private sector. At the end of the day, you could say, well, why is it so? Health is a public good, and this should be handled by public players. And the reality and the experience has shown that it is not the way it has worked. And interestingly, the innovation...
Just on that, to go in the other direction, I was giving a lecture in Hanoi, 10 years ago. And I had a translator, and I say, well, the communist countries never discovered a drug. So the translator say, should I translate? And say, yes, you should.
So that's very, so you go into that direction. So I think that if there is one thing what this industry is really bringing is the ability to, and of course, you could argue that this innovation can be partly coming from the university area. So it's a way, and all this way of transforming, pure academic research on actual treatments. And here, the only system which has worked so far is, having a contribution of a private sector and obviously a profitable sector. So I think that's really, to me, extremely important. Now, the second point, which is important in my view, and you mentioned the point of chemical versus or small molecules, as we like to say in this industry, and biological drugs, and the fact that some of us missed this new generation and so on. Here again, I think that the outcome is that the way to progress is competition. There are ones who are good and ones who are not good. There are some biotech industry which has developed dramatically successfully in the US in particular, but some also in Europe in the past 20 years. So it's like any other industry. Competition, providing this organized, appears to be still the best way to promote innovations and new treatment being made available. The third point, and I like to say, is that you're right to say that the progress in genomics will make the cost of identifying the genome of an individual as much cheaper. But on the other hand, all the direction we are taking is a direction towards personalized medicine, which is a very good direction. But one of the consequences of that is that a drug will treat not 10 millions of people, but maybe 10,000s of people, because each drug will be devoted to a specific type of, people linked to their genetic characteristics or whatever. So I think that's one of the difficulties in this industry. On one hand, you create productivity, and this productivity helps you to develop productivity on innovation, which helps you to develop, definitely new drug. But these new drugs very often meet a need which is very limited in terms of number of people. And you can always argue that probably there is part of these people who are not being identified because of the 7 billion people living in the world. We are back to the question of having any...
Could we say it a bit differently? Because the basic idea is right, but what will genomics bring is that we will know, and we are starting to know, people who are sensitive to the drug and people who are not. So the consequences of the one you are saying, that is, a number of drugs will be sold, because as you know, today, drugs don't work for certain person and don't work for others, and so far we didn't know why, and we are starting to know why. So the market is going to decrease for that reason, because all of us will probably have our genome on our portable phone.
So on your point, Jean-Michel, I mean, what I was trying just to say that this sector, like any other, is more complex than anybody would like it to be. So, I mean, you have the governments on one hand, you may have some, I mean, multinational or international, should I say, bodies, and you have multiple players addressing multiple type of diseases in different areas, in different areas of the world. So, I mean, to me, yes, we could look for some global principles in the way to handle global health, but we must recognize on the other hand that a lot of this remains local, and local by many means. I mean, whether it's, I mean, at the level of states, it can be at the level of regions. It is definitely linked to the way the health system is organized. And to me, there is a lot of inefficiencies.
What do you think of the idea of controlling the generic industry, having a world agency able to control the generic industry?
I think it's an idea that could be. What do you think? You are a
well, we are the second biggest generic producer.
Yeah, I know.
And so, how would you say control? You mean the quality or the market authorization, or what is the?
No, your quality is controlled. I am not. The problem is on the other hand. The distribution, when you are in Niger or a very poor country, you get generics which are not generic, in fact. So the problem is not controlling you. The problem is being sure that the people, the poorest people of the world, get generic from Novartis and not from whatever, Yeah. So, and I think that is very important in order to make the access to generic drugs to people, because they are afraid of having access to generic because the quality of the generic at the end is not controlled.